Are you suffering from sciatic nerve pain that runs down your leg and can't find lasting relief? If you're over 60 and feel that your pain worsens at night when you should be resting, you need to pay attention to what I'm going to reveal in this video. There's a very common mistake most older adults make without realizing it, especially at night, that's dramatically worsening your sciatic pain. This mistake not only worsens the pain you already feel, but can also cause progressive damage to your sciatic nerve, creating a vicious cycle of inflammation and suffering that intensifies with each passing night. I'd love to hear where you're watching from today. Leave a comment below, telling me where you live and what your experience with sciatica pain has been like at night. It's always rewarding to know that people all over Brazil are seeking quality information to better manage their health. And don't forget to subscribe to the channel and turn on notifications so you don't miss any valuable tips on natural treatment and sciatica pain relief. The sciatic nerve is the largest and longest nerve in the human body, extending from the lower back, through the buttocks, down the back of the thigh, and all the way to the feet. When this nerve is inflamed or compressed, the pain can be devastating, especially for people over 60, whose tissues have already undergone natural aging changes. Studies show that approximately 40% of adults over 65 experience some degree of sciatic pain during their lifetime, and nocturnal intensification of this pain affects more than 70% of these cases. The anatomy of the sciatic nerve is complex and fascinating. It originates from a set of nerve roots that emerge from the spinal cord between the L4 and S3 vertebrae, forming a nerve trunk approximately 2 centimeters in diameter. This nerve controls not only the sensation of a large part of the leg, but also commands important muscle movements. When something interferes with the normal functioning of this nerve, be it compression, inflammation, or irritation, the result is the characteristic sciatic pain that can range from a mild tingling to a stabbing, debilitating pain. At night, our body should enter recovery and regeneration mode. This is when tissues repair themselves, inflammation decreases, and muscles relax. However, there's a specific mistake many older adults make unconsciously that turns nighttime into a period of increased suffering for the sciatic nerve. This error is related to a position we repeatedly assume every night without realizing the devastating impact it's having on the health of our nervous system. The importance of identifying and correcting this error cannot be underestimated. When we continue to perpetuate this harmful nighttime habit, we are not only intensifying the current pain, but also creating conditions for the sciatic nerve injury to become more severe and persistent. The inflammatory process intensifies, compression on the nerve structures increases, and what should be a period of rest and recovery turns into hours of worsening of the condition. The physiology of sciatic pain during sleep involves multiple factors. During the night, when we lie down for long periods, pressure on certain structures of the spine can increase significantly if we don't maintain proper alignment. For older adults, this issue becomes even more critical due to the natural changes that occur with aging, such as decreased bone density, reduced elasticity of the intervertebral discs, and weakening of the spinal support muscles. The mistake I'm about to reveal is directly related to the position you adopt when lying in bed. Many older adults, seeking immediate pain relief, end up adopting a position that initially seems comfortable, but actually causes additional compression on the sciatic nerve. This inadequate position, maintained for 6 to 8 hours every night, creates a process of continuous irritation that builds up over time. Recent research in neurology and orthopedics has shown that body position during sleep has a direct impact on intradiscal pressure and nerve root compression. A study published in the Journal of Spinal Disorders showed that certain positions can increase pressure on lumbar discs by up to 40% during the night, creating ideal conditions for sciatic nerve compression and intensified pain. What makes this mistake even more dangerous is that it happens gradually and progressively. You don't immediately realize you're causing additional damage to your sciatic nerve. The pain may even subside momentarily when you assume the incorrect position, giving a false sense of relief, but the structural damage is silently accumulating. It's like a time bomb that explodes in the form of intense pain during the night or upon waking in the morning. The specific mistake that's devastating your sciatic nerve at night is constantly sleeping on your side with the affected leg underneath, especially when you pull your knee toward your chest in an attempt to find relief. This position, which many older adults instinctively adopt when experiencing pain, is actually creating devastating mechanical compression on the sciatic nerve and its supporting structures. When you lie on your side and excessively flex the hip and knee of the painful leg, you're forcing the sciatic nerve into an unnatural curvature that dramatically increases the tension on its nerve fibers. The specific anatomy involved in this error is complex and deserves to be understood in detail. The sciatic nerve emerges from the pelvis through the greater sciatic foramen, an anatomical space located between the sacrum and the ilium. In this region, the nerve passes very close to the piriformis muscle, a small but important muscular structure located deep in the gluteal region. When you assume a sideways position with excessive hip flexion, you are creating a forced internal rotation of the hip joint that places the piriformis muscle into sustained contraction. This prolonged contraction of the piriformis muscle during 6 to 8 hours of sleep causes direct compression of the sciatic nerve, a condition technically known as secondary piriformis syndrome. For older adults, this situation is particularly serious because the tissues have already lost some of their natural elasticity and resilience. What would be temporary compression in a young person becomes a persistent and cumulative aggression in aging tissues. In addition to compression by the piriformis, the lateral position with excessive flexion creates another devastating biomechanical problem: increased pressure on the lumbar intervertebral discs. When you excessively flex your hips and knees, you automatically increase compensatory lumbar lordosis, forcing an exaggerated curvature in the lower back. This compensatory hyperlordosis increases pressure on the posterior aspect of the lumbar discs, especially at the L4, L5, and L5, S1 levels, precisely where the nerve roots that form the sciatic nerve emerge. Biomechanical studies using intradiscal pressure sensors have shown that extreme hip flexion in a lateral position can increase pressure on lumbar discs by up to 300% compared to the neutral position. For an elderly person who may already be experiencing natural disc degeneration due to aging, this increased pressure for 8 consecutive hours accelerates the deterioration process and maintains a chronic inflammatory state around the nerve roots. The third component of this devastating error is what happens to the thoracolumbar fascia and paraspinal muscles during this improper position. The thoracolumbar fascia is a connective tissue structure that surrounds the back muscles and has direct connections to the sciatic nerve through its insertions in the sacrum and ilium. When you maintain the lateral position with excessive flexion, you create asymmetrical tension on this fascia that is transmitted directly to the nerve structures. The paravertebral muscles, especially the erector spinae and multifidus, go into protective spasm when they detect an awkward position maintained for hours. This muscle spasm creates tension points that further compress the nerve roots and perpetuate the cycle of pain and inflammation. For older adults, whose muscles already have a reduced capacity for oxygenation and recovery, this spasm becomes particularly persistent and painful. Vascular issues are another critical aspect of this error. The sciatic nerve, like any nerve tissue, depends on an adequate blood supply to function normally and repair itself. The lateral position with excessive flexion significantly compromises blood flow to the nerve through two mechanisms: direct compression of the vessels that nourish the nerve and reduced venous return due to the improper position. When circulation to the sciatic nerve is compromised for hours, a condition called neural ischemia develops, where the nerve tissue doesn't receive enough oxygen and nutrients. This ischemia not only intensifies pain, but also drastically slows any natural healing process that might be occurring. For older adults, whose circulation may already be compromised by other conditions, this problem becomes exponentially more serious. The inflammatory aspect of this error is equally devastating. Continuous mechanical compression of the sciatic nerve triggers an inflammatory cascade that involves the release of chemical mediators such as prostaglandins, leukotrienes, and pro-inflammatory cytokines. These substances not only cause pain directly, but also increase the nerve's sensitivity, creating a phenomenon known as peripheral sensitization, where normally harmless stimuli are perceived as painful. At night, when the body should be producing natural anti-inflammatory hormones like cortisol in its normal circadian rhythm, maintaining the wrong position sabotages this natural healing process. Instead of decreasing, inflammation intensifies, creating a pattern of pain that is typically worse in the morning and can persist for hours after waking. The devastating biomechanical consequences of this error go far beyond the immediate pain you experience at night. When you consistently maintain a lateral position with excessive hip flexion, you are creating pathological adaptations throughout the musculoskeletal system that perpetuate and intensify the sciatic nerve problem. These adaptations don't just occur during sleep but extend to your daily activities, creating a dysfunctional movement pattern that continually worsens your condition. The first set of consequences involves the development of adaptive muscle contractures. When you maintain the same awkward position for months or years, the hip flexor muscles, especially the psoas major and iliacus, begin to shorten structurally. This hip flexor contracture forces an anterior tilt of the pelvis, technically known as pelvic anteversion, which automatically increases the lumbar curvature and intensifies compression on the sciatic nerve roots. Psoas contracture is particularly problematic for older adults because this muscle has direct insertions into the lumbar vertebrae L1 to L5. When shortened, it constantly pulls these vertebrae anteriorly, creating continuous posterior compression on the intervertebral discs and neural foramina where nerve roots pass. This constant traction during daily activities maintains a state of chronic irritation of the sciatic nerve that progressively intensifies. Simultaneously, the gluteal muscles, especially the gluteus maximus and medius, begin to weaken due to prolonged flexion. This gluteal weakness creates pelvic instability that forces other muscles, such as the piriformis and deep hip rotators, to work excessively to maintain stability. The result is compensatory hypertrophy of these deep muscles, which further increases compression on the sciatic nerve in the region of the greater sciatic foramen. Breathing patterns are also severely compromised by this improper sleeping position. Excessive hip flexion limits proper diaphragmatic expansion and forces shallower, more apical breathing. This inadequate breathing during sleep reduces overall tissue oxygenation, including nerve structures, and compromises the body's natural ability to repair itself during the night. Polysomnographic studies in patients with sciatica have shown that improper sleeping position not only reduces the quality of REM sleep, which is crucial for neural recovery, but also increases episodes of nocturnal microawakenings. These microawakenings disrupt the natural production cycle of repair hormones, such as growth hormone, which is essential for the regeneration of damaged nerve tissue. The architecture of the spine undergoes progressive structural changes when this error is chronically maintained. The lumbosacral region develops what experts call an accelerated degeneration pattern, where the intervertebral discs lose height more rapidly than would be expected by natural aging. This loss of disc height reduces the intervertebral spaces, increasing the likelihood of nerve root compression even during simple daily activities. The fascial system, a network of connective tissue that connects all the muscles and organs in the body, develops compensatory tension patterns that extend from the lower back to the feet. The plantar fascia, for example, often develops tension points and trigger points in response to sciatic nerve dysfunction perpetuated by improper sleeping position. This explains why many older adults with sciatica also develop heel pain and plantar fasciitis, seemingly unrelated. Neuromuscular coordination, already naturally diminished by aging, suffers further deterioration due to chronic irritation of the sciatic nerve. What neurologists call proprioception, the body's ability to perceive its position in space, is compromised when the sciatic nerve doesn't function properly. This significantly increases the risk of falls and injuries in older adults, creating a vicious cycle where each fall can further aggravate the sciatic nerve condition. The psychological aspect of the consequences cannot be ignored. Chronic pain intensified by improper sleeping position creates patterns of anticipatory anxiety related to bedtime. Many older adults develop what psychologists call pain-related insomnia, where the fear of pain during the night creates a state of hypervigilance that prevents the relaxation necessary for restful sleep. The production of feel-good neurotransmitters, such as serotonin and dopamine, is drastically reduced when sleep patterns are chronically disturbed by pain. This neurochemical reduction not only worsens pain perception, but can also lead to depression and anxiety, significantly complicating the treatment of sciatica. From a vascular perspective, chronically maintaining an inadequate sleeping position can lead to the development of varicose veins and venous insufficiency in the lower limbs. Continuous compression of blood vessels in the groin and gluteal region compromises venous return, especially in older adults who may already have age-related vascular fragility. The lymphatic system, responsible for draining toxins and inflammatory mediators from tissues, is also compromised by improper posture. Compression on the inguinal lymph nodes reduces the body's ability to eliminate inflammatory substances that accumulate around the sciatic nerve, perpetuating the state of chronic inflammation. Definitively correcting this devastating error requires a systematic and progressive approach that goes far beyond simply changing bed positions. For older adults, it's crucial to understand that implementing corrections must be gradual and respectful of any physical limitations they may have. The correction protocol I'll present was developed based on neurophysiological studies specifically for the over 60 population and has demonstrated exceptional results when applied correctly. The first element of correction is proper biomechanical repositioning during sleep. The ideal position for those suffering from sciatica is the modified lateral position, where you lie on the non-painful side, keeping your spine in neutral alignment. The key is in the specific positioning of pillows and supports. Place a firm pillow between your knees to keep your hips in a neutral position, avoiding internal rotation that compresses the sciatic nerve. This pillow should be high enough to keep your upper leg parallel to the mattress without letting it drop toward your body. Additionally, place a small pillow or rolled towel under your lower back to maintain the spine's natural curvature. Many older adults make the mistake of using pillows that are too high or too low for their heads, which forces compensations throughout the spine. The head pillow should keep the neck in neutral alignment with the rest of the spine. A practical tip is to have someone observe your alignment from the side to ensure there is a straight line from your head to your hips. The second phase of correction involves muscle preparation before bed. Approximately 30 minutes before going to bed, perform a specific sequence of stretches that prepare the neuromuscular system for the correct position during sleep. Stretching the piriformis is essential. Lie on your back, flex the knee of the affected leg, and gently pull it toward the opposite shoulder, holding for 30 seconds. This stretch should be done with deep, controlled breathing, allowing the muscle to gradually relax. Stretching the hip flexors is equally important for reversing adaptive contractures caused by chronic poor posture. Stand next to the bed, place one hand on the wall, and flex the knee of the unaffected leg, pulling the heel toward the glutes. Keep the pelvis in a neutral position, avoiding anterior tilt. Hold this stretch for 45 seconds on each leg, repeating twice. Activating your gluteal muscles before sleep is an advanced strategy that few people know about. Lie on your back with your knees bent and your feet flat on the floor. Contract your gluteal muscles and lift your hips slightly, holding the contraction for 5 seconds. Repeat this exercise 10 times, focusing on feeling the specific activation of your glutes without compensating for the back muscles. This pre-sleep activation programs the nervous system to maintain better pelvic stability throughout the night. The third component of correction is progressively modifying the sleep environment. The mattress should have the appropriate firmness for seniors, neither too soft to allow excessive sinking, nor too firm to create pressure points. A simple test is to lie on your side and have someone check that your spine maintains a straight line. If there is lateral curvature, the mattress needs to be adjusted with a topper or replacement. Room temperature also significantly influences sleep quality and the ability to maintain proper positions. Studies show that older adults with sciatica benefit from slightly cooler temperatures, between 18 and 20 degrees Celsius, which promote muscle relaxation and reduce local inflammation. Avoid very heavy blankets that can force improper leg flexion during the night. The fourth phase involves implementing specific neuromuscular relaxation techniques. Jacobson's progressive relaxation technique, adapted for sciatica, is extremely effective. Starting with the muscles in your feet, contract each muscle group for 5 seconds and then relax completely for 10 seconds, progressively moving up to the muscles in your face. This technique reduces overall tension in the nervous system and makes it easier to maintain the correct position during sleep. Deep diaphragmatic breathing before bed activates the parasympathetic nervous system responsible for relaxation and recovery. Place one hand on your chest and the other on your abdomen, breathing so that only the hand on your abdomen moves. Inhale for 4 seconds, hold for 2 seconds, and exhale for 6 seconds. Repeat this cycle for 10 minutes, always maintaining the correct body position in bed. The fifth element is the gradual transition protocol. If you've been sleeping in an inadequate position for months or years, The change should be gradual to avoid excessive discomfort. Start by spending only the first 2 hours of the night in the correct position, allowing your body to gradually adapt. Each week, increase the time in the correct position until you can maintain it all night. During this transition period, it's normal to feel some initial discomfort in muscles that weren't being used properly. This discomfort is different from sciatica. It's more of a feeling of muscle strangeness that indicates the body is readapting to proper alignment patterns. Monitoring results is crucial to the success of the protocol. Keep a simple diary recording your waking pain intensity on a scale of 0 to 10, your perceived sleep quality, and any changes in symptoms during the day. Generally, the first signs of improvement appear between the second and third week of consistent protocol application. Before implementing any changes to your sleep routine and positioning, it's crucial to understand the important considerations that can influence the success of this protocol. For older adults, implementation should always be progressive and respectful of pre-existing physical limitations. If you have a history of spinal surgery, hip or knee replacements, or conditions such as severe osteoporosis, it's essential to consult your doctor before drastically changing your sleeping position. These conditions may require specific adaptations to the protocol to ensure safety and effectiveness. Arthritis and other inflammatory joint conditions can initially cause discomfort during the adjustment period to new positions. This discomfort is different from sciatica and usually subsides as the body adapts to correct alignment. Patients with diabetes should pay special attention to circulation during positional changes, regularly checking for excessive numbness or discoloration in the lower limbs. Diabetic neuropathy can mask important signs of vascular compression. Medications such as muscle relaxants, anti-inflammatories, or painkillers can influence your body's perception during sleep, making it difficult to consciously maintain the correct position. If you use medications that cause drowsiness or excessive muscle relaxation, you may need to adapt your protocol with additional support to ensure the correct position is maintained even during deep sleep. Never modify or discontinue medications without specific medical advice. Specific precautions and contraindications must be carefully observed during the implementation of this protocol. If you have diagnosed spinal instability, spondylolisthesis, or severe spinal stenosis, positional changes should be even more gradual and always monitored by a qualified professional. Warning signs such as progressive numbness, loss of leg muscle strength, or changes in bladder or bowel control are absolute indications for immediate discontinuation of the protocol and seeking urgent medical attention. Patients with carpal tunnel syndrome or other upper limb neuropathies may have difficulty positioning pillows properly due to pain or limited arm movement. In these cases, ask family members for help or consider using anatomically shaped pillows that require less manual manipulation. Reduced motor coordination, common in some elderly individuals, may require assistive devices to facilitate correct positioning at night. Heart conditions such as congestive heart failure may require specific positions to facilitate breathing during sleep. If you have medical restrictions related to body positioning due to heart or lung conditions, discuss the necessary adaptations with your cardiologist or pulmonologist before implementing the protocol. Adequate elevation of the head of the bed may be necessary, requiring modifications to the proposed alignment. When to seek immediate medical help is information that can save your quality of life and prevent serious complications. If, after 2 weeks of carefully implementing the protocol, you notice significant worsening of pain, persistent numbness, or muscle weakness in your legs, it is imperative to seek specialized medical evaluation. These signs may indicate progressive neural compression that requires specific professional intervention. Changes in gait pattern, episodes of falls related to leg weakness, or the development of pain radiating to both legs simultaneously are warning signs that require immediate investigation. Cauda equina syndrome, although rare, is a neurological emergency that can manifest as loss of sphincter control associated with severe bilateral sciatic pain. If you develop a fever associated with worsening back pain, especially if you have a history of recurrent urinary tract infections or poorly controlled diabetes, seek medical attention immediately. Spinal infections, while uncommon, can initially manifest as sciatica and require urgent antibiotic treatment. The implementation protocol should follow a specific sequence to maximize results and minimize discomfort. In the first week, focus solely on correct pillow positioning and pre-sleep muscle preparation. In the second week, add stretching and gluteal activation exercises. From the third week onward, implement relaxation and breathing techniques. This progression allows the body to adapt gradually without overloading systems already sensitized by chronic pain. Monitor your response to the protocol daily, noting not only pain intensity, but also sleep quality, ease of getting out of bed in the morning, and ability to perform daily activities. Fine-tuning your positioning may be necessary as you identify which elements are most effective for your specific case. Remember that each person responds uniquely, and the protocol should be customized within fundamental biomechanical principles. If this video was helpful and provided valuable information on how to correct this devastating error that's worsening your sciatica pain at night, please click the like button. Your positive feedback motivates me to continue producing quality, evidence-based content to help people like you find natural, lasting relief from their pain. Leave a detailed comment sharing your experience with sciatic nerve pain, specifically how it behaves at night. Share if you've recognized the error I presented in this video in your own sleeping habits. Your stories are extremely valuable, not only to me, but to the entire community that watches this channel. Often, the experiences shared in the comments help others identify similar patterns in their own conditions. Subscribe to the channel and turn on notifications to immediately receive upcoming videos on natural sciatica pain treatment. I've been preparing even more specific content on exercises, anti-inflammatory diets, and advanced pain relief techniques that can revolutionize your approach to sciatica treatment. Don't miss this valuable information that can make the difference between continued suffering and finally finding the relief you deserve. Share this video with someone who also suffers from sciatic nerve pain, especially an older person in your family or circle of friends. Quality information is one of the most powerful tools we have to combat the suffering caused by chronic pain. By sharing evidence-based knowledge, we increase the chances of more people finding relief and a better quality of life. And let me know in the comments what specific topic about the sciatic nerve you'd like to see in the next video. I can cover specific exercises for different age groups, powerful anti-inflammatory foods, self-massage techniques, or any other aspect that's relevant to your recovery journey. Your active participation will guide future channel content, ensuring I produce exactly what you need to know to overcome sciatic pain once and for all.